Hi, everyone. Welcome. I am so honored to be here today with all of you and with our panelists. My name is Claire Bidwell Smith. I'm a therapist specializing in grief and the author of several books about grief and loss. Been in private practice for over a decade, worked in hospice before that, and have gone through my own losses. And I am just so honored to be here for this really important conversation. I'd like to introduce our panelists. Dingle Spence is a consultant oncology and palliative care physician. She's also the director of the Hope Institute Hospital in Kingston, Jamaica. And she is an associate lecturer at the University of West Indies in Jamaica. She's been working with Neil and Allyson around psychedelics and grief. Neil Hanon is a psychiatrist and assistant clinical professor at the University of British Columbia. He's also a bereaved parent. And Allyson Rockwell is also a bereaved parent. She's explored psychedelics to manage her grief at a retreat in Jamaica. So welcome, everybody. I'd love to start by just kind of opening this up, perhaps to Neil first, but more than ever in the last couple of years, I've had so many clients coming to me and feeling really curious about trying psychedelics for grief. It's not something I have tried, and so I've had some questions, a lot of unknowns about where to direct them, what the experience is like, what to expect. I would love to hear from you, Neil, and all of you about where we can begin with that.
Yeah, it's a really important question. Psychedelics, or psilocybin, or other psychedelic compounds for grief is a really novel new way to, maybe not so new. Mushrooms have been around for forever, but new to modern psychology, psychiatry as a treatment model. And I myself am a grieving parent. My 17-year-old son died in a car crash. So I actually can legally take mushrooms in Canada as well because I've been granted a Section 56. One of the only places in the world that you can actually do mushrooms legally is Jamaica. So that's another location. However, it is really important to be doing, if you're going to do mushrooms, that you have a clinical team around you who understands grief and understands psychedelic compounds and how to work with psychedelic compounds in grief and mix those with the therapy. Mushrooms themselves for a grieving parent may actually traumatize them without that treatment team around them. And so that is really, really important. It's not you take mushrooms and your grief is gone. It's not like that at all. You need really informed professionals around you. And Allyson, maybe you can chip in.
I could definitely say that. So for myself, I lost my son a year and a half ago. He was 17 as well. And COVID hit right after he passed, and things were just crazy. And I was looking for anything to help. And I found this retreat in Jamaica. I talked with Francoise Borzat, and she was putting together this retreat with Neil and Dingle and Chris Adrian, who's also speaking today. And it was the first time this has ever been done. It was in Jamaica, and it was a retreat for parents who've lost children. And it was really powerful and unbelievable, but I couldn't have imagined going through this without really well-trained people who knew how to help me. My husband went as well. And for all the other parents that were there, the support we had before and after and continuing now is part of the whole thing and is really important because it was really intense. It was, I mean, I can go into it, but it's that idea that when you're in pain, in that kind of pain, it was the first thing that happened to me was somebody said, here, take Prozac, take an antidepressant, it's pain. You want to move away from that pain as much as possible. And what psilocybin has helped me do is to face that pain and to get in touch with it because it's not going anywhere. And running from it just postpones, how it's going to envelop you. But the use of psilocybin has helped me really like be able to get in touch with it and know it and go there. And it's not easy. I mean, it's probably the hardest thing I've ever done. But in the long run, it helps me live with that. So.
Thank you. I want to dive back into some of that, but first, maybe just to go back to the structure of what this looks like. And Dingle, maybe you can speak to this because you've been part of these assisting people, correct? What does that system look like? So you're doing therapy first, then the psychedelic treatment, then more therapy? Like, what does the structure of it look like? What's the ideal scenario for this?
Yeah, I think that's exactly right. And I would absolutely echo both Neil and Allyson saying, this is not something you do on your own in a dark room. So I think what was nice is that we were able to provide the structure. So, we really prefer if parents can have had some psychotherapy after their loss, perhaps before they even reach out to us. But then once they do reach out to us, we have a team of trained guides. And so, you'd have an introductory meeting and then a couple more meetings to, see where the parents are and to help them understand the process of the retreat, which I'll tell you a bit more in a minute. So there's definitely a pre-therapeutic encounters, and that may be 2 or 3 or 4, depending on what the parents need. And then what we did is we actually brought them to Jamaica, and we had a 5 or 6 day structured retreat. So people, on the first day, we invite parents to sit around and tell the story of their child, which of course is very emotive. And then later that day, the parents, kind of got their hands dirty and did a bit of pottery. This is Neil's suggestion, you sort of break people open, but then it's good to do something creative, and got the hands in the clay because the retreat space is right next to a beautiful pottery. But then, and then we gradually lead up to the actual journey, the medicine journey, which I think was done on the 3rd day. And what we're helping parents do is to set their intention for the journey. What are you hoping to achieve? Very, very critical when we're doing mushroom work, as I've discovered doing my own mushroom work, is that the intention is critical. And then, the parents' journey in a group, there's many, many assistants in the room and trained facilitators. And then, the following day, we talk about, how that was. And then it felt like people had to go home a bit too soon. A lot of people would have liked to have stayed a bit longer, but we're thinking about how to alter that in the next retreat. But then I think the aftercare is critical, what we call integration. Absolutely important. And that continues on. It's not just like, next week and 2 or 3 weeks later, as Allyson said. I mean, the retreat was in March, it's now October, and people are still processing it. It takes a long time because I think it's the proverbial onion. You peel off a layer and then there's more. And then you peel off and there's this too. And I think what the medicine does, we call it the medicine, the psilocybin mushroom, really helps people dig down deep and peel those layers off in assistance with psychotherapy for sure.
Oh my gosh, I have so many questions. Let me start with a kind of broad, basic one. Why grief? Why is this helpful for grief?
For me, it's helpful for grief because it's like helping me get in touch with things. Like you read things or you hear things like going into that well or pit, or you talk about inner child. And I don't know, for me, up until I started this therapy, I never really and truly understood what things like that meant. And now when you talk about it, I mean, I can feel it so deeply and I'm so in touch with those things. So it's learning really what's inside of you, and then it's processing it. And processing it is with my guide, with my therapist. I have a grief therapist as well that I use to help process it. So it all slowly bubbles up. And when these realities bubble up, they're so big and they're so intense. And so it's, it's amazing to be able to get there. But then once you get there, what do? And that's having the support team around you to help.
Wow. It's interesting that all the research that's been done on psilocybin, whether it's for end of life distress or hard to believe, but there was a smoking cessation trial with psilocybin that was successful as well. But all of these, it's a correlation with a mystical spiritual experience during the psilocybin that has the most dramatic impact. Now, that's not to say, and 70% of people will have a mystical experience on psilocybin, but that's not to say the other 30% don't have therapeutic benefit. It's interesting, grief over loss of a child, one of the most complicating factors is, how is it possible that my child was here 1 minute and now they're not here? And how do I continue to have some kind of relationship with my child even though they're not here anymore? And psilocybin mushrooms teach you how to do that.
So is it a combination of helping you be in your grief, but is it also about understanding death and understanding our relationship to our lost loved ones? Is that what I'm hearing?
Absolutely. Go ahead with that, Allyson.
I think it's, in my reality, going through this process, it might sound kind of out there, but it's like this reality has come over me, is that there's a here and there's a there. I'm here, my son is there, he's here, but he's just in this other place, that he's not physically here, but he's definitely spiritually here. Definitely. And, it's that, and I'm sure, Dingle, when you're talking about palliative care and end of life and, the mushroom, it's like this idea that this is a life, this is one life, and it's one of maybe many. And, we're physically here for a time and then we're somewhere else for a time. And it's this idea of death and fear of death. And, it's not there anymore. It doesn't exist in my world, at least.
That sounds deeply comforting. Dingle, do you want to add to that?
Thank you. I think that's really so. I work with a lot of patients, and I haven't yet been giving psilocybin to my patients in Jamaica, but I think many people who work in palliative care would be very, very familiar with the phenomenon whereby people who are coming to end of life see and also often speak with relatives who have gone before them. And that's often a great comfort. People say, oh, my mother's standing at the end of the bed. And of course, we can't see that person, or most of us can't. But so I'm already very familiar with that kind of mystical side. A lot of people are afraid to talk about it because they think, oh, we're going to be labeled as crazy. And, in our very Christian culture, seeing spirits is not something that is comfortably discussed, but it happens all the time. And I think, what psilocybin is doing is maybe giving us relatively well people access to that veil. Neil, I know you had a spiritual experience where your son contacted you. I don't know if you want to speak about that, but I think that, as Allyson says, the veil between us and the other world is somehow helped to dissolve with the use of psilocybin. So it gives you that continuity of understanding that your loved one is not really literally gone. They're gone from the form that you knew them in.
And I'd just like to point out something about standard psychiatry and standard psychology, which is the cognitive understanding of something. And cognitive behavioral therapy is very useful for helping with grief and so on. But when you use psilocybin mushrooms, you experience, sometimes you experience your loved one and they are there and you are experiencing them, or you're being downloaded some information about the way the universe works, really, but you're experiencing it. And that's the difference. It's like you feel and you understand in a completely different way. than in our, our societal frame of cognitive is all that there is. And that's not true. Once you have a mushroom experience for something like grief and loss of a child, it's a completely different level of understanding. And it is so incredibly important for parents who have lost a child, because they end up being dysfunctional. I was dysfunctional. I don't know, Allyson, how dysfunctional you were, but most parents are pretty dysfunctional after the death of their child. And it just changes the frame. And that's the important thing.
I've been working with a lot of bereaved parents, and I'll attest to that. They're really struggling. I see a lot of anxiety as well. Is this helpful with anxiety? And then also, what if you have anxiety about doing the medicine?
I think for me, I did obviously having, I'm in this place where I've had this loss and the world's crazy because it's COVID. And that's where the guide comes in. I had Francoise Borzat was who I was dealing with for, she was my guide going into Jamaica. And I said, what do you mean? We're going to go and we're going to take mushrooms with a bunch of strangers? Like, this is crazy. There's no way I'm doing this. Like, what do you, and we talked and got to the point where I was comfortable with it, but I didn't, I wasn't like, oh boy, this is a great idea. It was like, okay, I'm ready to try something, but get me there, help me to be comfortable with this. So it took a while, but by the time I got there, I was. And when we got there, it wasn't like we jumped right into it either. We were as a group, and we, walked and we talked and we ate together and we got to know each other. And we did a medicine circle the second night, which was a small dose of mushrooms. And it just kind of opened everybody up a little bit. It was really this amazing connection. So prior to the actual journey, we were really connected. And I would say now, I've been to other groups of bereaved parents, but the parents that I was, in Jamaica with, were like connected now. It's a totally different thing than the other groups I've been to or talked to. We're like magnetically like connected. We get together and it's like we've known each other forever. It's very strong, the bonds.
And I just want to point out something about that I think psilocybin would work with individuals, not in a group context, but it's so much more therapeutic for parents who have lost a child to be doing psilocybin in a group together. It's so much more healing. The fact that anybody who's lost a child is automatically in a group together, but you do something like psilocybin, healing psilocybin journey with a group of bereaved parents, and there's this whole another element coming in of connection, and it's very, very therapeutic.
Is there a certain time frame for people, bereaved parents, or anyone who's going through grief to do something like this? Is it something they can do right away? Do they need to be a certain length of time out from their loss, or do they need to have worked through some aspect of it? Dingle, you mentioned setting intentions at the beginning of these retreats. Does that play into this? Can you tell me a little all about that?
So I'm happy to talk about intentions, but I think I would defer to Neil first for the first part of your question about time frame and whether people need to have had therapy before, because I think that's perhaps better answered by you, Neil.
Okay, so I can start, and then Dingle can take over. So first off, this is early days, so where we're doing this. But what it appears is if a person is too early in their grief, it's not a good time to be doing a psilocybin journey. They have to be, there's, as you know, as a grief therapist, there's the acute grief time period. And we don't think, in our group, we don't actually think that that's a good time to be doing psilocybin mushrooms. The person has to actually be over the acute grief phase, and be stuck somehow, and have an idea of their stuckness, and then that's the time that we think that they should be that a psilocybin mushroom journey would be useful. So, but I'll let you carry on, Dingle.
So, Claire, you mentioned intention setting. And I mean, I've been doing my own journeys, guided journeys over the last year, and I have come to realize how absolutely critical setting an intention is. And it's not something you come up with, overnight. It's you work on it with your therapist or your guide and just think about, what is it that I really want to be able to do? To feel, is it connecting with my child? Is it feeling my grief all the way through? Is it, and everybody's going to be different. And then, and that intention is usually stated literally as people are about to, we're sitting in group, and people will go around, will say, state your intention again before you actually ingest the mushrooms. And this is where it becomes mystical to me, in that, and it's something that we say in the mushroom circle, is that, you will get what you need, but it may not necessarily be what you thought you wanted. And Allyson might want to take that up. But personally, I've discovered that I wanted something, intended something, and I realized after my own personal journey, I lost my mother nearly a year ago. So I've been in that grief process too. I got what I needed, which was then clearer to me after my experience, why I had that particular journey and not the one that I was hoping to have, or that I might have been expecting to have. And so I think there's a lot of trust and faith that goes into it. And that as you step into that world, really you need to trust the medicine, because the medicine will give you what you need. And I'd love Allyson to pick up from there.
So, yeah, I mean, exactly everything Dingle said. I mean, you said a journey, but the medicine does what it needs to do. And it can only do what it needs to do if you trust the medicine, if you trust the guide that you're with, and if you're in a safe place. And I mean, I was lucky enough to have amazing guides and be in this unbelievable environment. And so I could just lean into it. And that's part of it. It was like, when I did my journey, I realized I'd been like, this is why I've been doing yoga for so many years. Like, I needed the breathing, I needed the centering, I needed every tool I had to be able to like lean into it and engage and trust and be there and be present. And for me, I mean, I don't even remember what my intention was, but I know that it cracked me open. I mean, it cracked me open, and it took me straight up to that like intense grief of losing my son. I mean, I was right there with it, and it was hard. I mean, it wasn't an easy thing, but I had the support to get me through, and I had the, support after, and, and I learned that was, coming out of it. What was clear is that that's what I needed to do. I needed to open to that versus close and run and push it away. The only way I was going to get through it was to be open to this, but I needed that intense experience to learn that.
Yeah, it sounds like it doesn't at all take away the grief. It just allows you to really be in the grief, which is so important. We can't run away from grief. I keep hearing you guys use the word stuck, and that's something that I see in a lot of the people I work with. We can do 2 years of talk therapy around grief, and still there are places where someone is stuck. And it kind of goes back to, I guess, what you're saying, Allyson. It really allows you to move through those places or sit in those stuck places. Can you guys speak to that a little bit?
I was clearly stuck. I mean, that was why I was like, okay, what can I do? I mean, I was doing talk therapy and I was taking antidepressants, and I was stuck. My husband was stuck. My husband started drinking a lot after our son died, and then he had stopped, and then it was like, okay, that doesn't make it better either. Where do we go from there? So it was clearly a stuck moment that led us to this treatment.
Neil, do you want to add to that?
I'm not sure if it's a good thing to say this, but I consider psilocybin kind of like a little bomb that goes off. And if people get stuck, it's the bomb that relieves the stuckness, you know? And so, but but because it is a bomb, you need all the support and the therapists and everything around you for that to help you through that. And you know, one thing in psychedelic therapy that we always say is the way out is through, and that's the way with grief. I mean, we as grieving parents, we get stuck all the time, and we get mini stuck, you know, MINI stuck, and sometimes we get big stuck, and sometimes the little ones can be gone through with talk therapy, but sometimes you need more than that. And psilocybin mushrooms in the right context really can help with that.
Mm-hmm. Thank you. So for a clinician like me or anyone out there listening, if we don't have training in this and a client comes to us having maybe gone to a retreat, what can we be thinking about as we help them process afterwards or talk with them through this?
I think that's yours, Neil.
You know, one of my teachers was Ralph Metzner, and Dr. Metzner always said, there's no point in going somewhere if you don't bring the information back. And there's no point in bringing the information back if you don't integrate it into your life. So as a therapist, you don't have to, you're dealing with integration of life events into people's lives all the time. And so so the question is, what were the things that happened in your journey? How can we bring those things into your life now that you learned? And how can you bring them into your everyday, into your relationships, into your work, into the way that you relate to the earth and everybody around you, and just bring it into the here and now as bring that stuff so that you don't waste any of it. Mm-hmm. That's the real, I mean, I think that's the real answer to your question. It just has to be solidly integrated into your life every moment of every day, because you were given a lot of really, really valuable information.
Mm-hmm. That makes a lot of sense. Before we open it up to questions, is this something that you would do repeatedly? Do you go on multiple retreats? Is one retreat enough to kind of really unstick you and start moving through different pieces? What do you guys think about that? Where's the future of this going? Should everybody be doing this?
I think it depends on who you are and where you're at. I know that some of the people on the retreat that we were at, you know, after the retreat, they were feeling pretty good. And it hasn't even been a year. So, you know, maybe they'll need to go back, maybe not. Others, you know, it's different. It depends. I mean, I think that, and Neil or Dingle, you can answer this better. I mean, it's not something you do back to back to back, because it's so important to process and integrate and bring it into your life. But, you know, I think when you get stuck again, then maybe it's something you go back to. And you know, when you're stuck, I mean, you go as far as you can with what you've learned. And then if you need it again, it's really, the medicine stays with you and it tells you it's time to go back. And only you can know that for yourself.
Mm-hmm.
I think Allyson put it beautifully. The only other thing I would add is I do not think it's good to do mushrooms any more frequently than every 3 months, because you really have to integrate the stuff. But I completely agree with Allyson that there is no schedule except this as your life and your integration tells you.
Oh my gosh, thank you. Do you want to add anything, Dingle?
No, I'm just in agreement. Yeah.
I could keep asking you guys questions for another hour, but there's a bunch of really great questions from our audience, so I'm going to get to some of these. The first one is, how do we get training to support people wishing to use these medicines to process grief? So I guess, how do therapists, counselors, anyone get training to support this?
Neil?
Well, there are all kinds of training programs that are popping up all over the place. What I would say is make sure you do your due diligence in researching them. I can say some, but I don't want to sell products for people. And I don't want to sell products that I'm involved in. But just there is training around. Make sure that you know the training, and CIIS, the California Institute of Integral Studies, has a training program that's there's reputable training programs around, and probably people can well. Anyway, I don't know what else to say there, but Dingle, do you have anything to say?
Oh, well, I'm in Jamaica, and I'm being trained, by a group that comes to Jamaica. But I think that's right. I think it's apparent to me that there's quite a lot of training out there, and you need to look it up and investigate. Maybe talk to people who've been through it before. But I think that there's a mushrooming of these opportunities, and particularly I think for people who are trained in psychology already. That it'd be easier to step into a program than if you didn't have a background at all.
That makes sense. Another question we have says, I know that clinical trials have been done in the area of processing terminal illness, but why haven't these translated into clinical practice? What do you think the timeline will be? Instead of waiting for the death to occur to process, why not confront it as fully as possible before it happens?
Okay, so I'll just grab that first. So I'm in Canada, and we have a wonderful health minister who is granting Section 56 exemptions, which means that the people are allowed to legally possess psilocybin mushrooms and take them for end-of-life distress. And I do work with people legally with end-of-life distress and help get them Section 56 exemptions and so on. And so those are completely outside of research trials. Now, the government of Canada wants more research trials and are encouraging all kinds of people and to do research trials. Outside of Canada, I'm not sure how easy it is to do any of those other things. And Dingle, I'm not sure where Jamaica is at in that stuff.
Yeah, so there's increasing interest in Jamaica because of, the mushrooms are not illegal. And so there's many groups looking towards us. I work with a particular company we are looking to construct palliative care trials with patients towards the end of life. And I think we're still in there. We know that it works, but I think we need more data, and we certainly need more data, because if it's going to actually become legal in the greater world, the US, fully legal in Canada, Europe, the regulatory authorities are going to want evidence. And so I think we are in that area of building the evidence, and certainly wanting to start and kick off with a trial in palliative care patients in Jamaica in the near future.
Okay. Thank you. I'm looking through some more of these questions. There is a popular one here that keeps coming up that wants to know if these experiences are best done in group settings, or are they just as powerful individually? I know you touched on this a little bit, but the question keeps coming up, so I thought we'd bring it back.
For me, the group allows me to think about things, or it makes me things that you would think are true, it makes me know are true. To have other people around. For example, when we were in Jamaica, it was two of the dads that brought to the table, it's different for a mother than a father. And I could say that and you guys would go, yeah, of course it's different for a mother. But it didn't make sense to me. And when I heard that in the group, and I heard it coming from the dads, not the moms, and I realized why my husband and I are so different in processing this. It made a huge difference to me. But by myself, that would have never become a truth.
That makes me a little teary.
I think it's just really important in parental grief that this be done in a group. That's really important. With end of life distress, that's an individual type thing. So so the way, depending what you're using psilocybin mushrooms for, depends how they should be used. But the parental grief, I mean, in our ancestral history, grief used to be a community event. And it's not anymore, but it needs to be. And so what's the starting community now? It's the other parents who have lost a child too. So that's, and that's the beginning of maybe getting it right, is doing this in a parental grieving community.
Mm-hmm. And I think this is what Allyson said, is that they are now, that group of parents are completely bonded. They've, 9 months after the journey, they're still together, as it were. And so they have their own mutual support group, which certainly wouldn't have manifest if not in that way anyway, and in that real deep way that I think Allyson was referring to, if they hadn't done the journey in a group.
I think group work is so powerful for grief. I can see it working well too for, loss of a spouse or a partner or loss of a parent. I think that coming together with people, like you said, Allyson, and just kind of understanding the whole experience for everybody is really important, and not feeling so alone. There's another question here that I actually had on my list, so I'm really curious about it. And Dingle, maybe you can talk about this. Is there any use for psychedelics for people that are pre-grieving as they take care of a loved one with a terminal diagnosis?
Oh, that's a really interesting question. I think we're just at the beginning of discovering all the dimensions where psilocybin can be useful. I do actually think so. And wouldn't that be interesting to have the caregiver and the ill person journey together? And, one of the things that Allyson said early on is that what we're trying to do is we're trying to just push the pain away. And I think that our society tends to do that with death and dying. It's like, oh, let's not look over there. And I think what the mushroom medicine helps us do is to be present to it. It's painful, but and again, as Neil said, the only way out is through. And so it's like, let's feel this. What does this really mean? Let's open to death and dying, and be present to it. And I really do see that mushroom medicine can help in that dynamic. And then, also in bereavement, not just necessarily bereaved parents, but any sort of bereavement, where grief is powerful and people, it's always powerful, but so I see multiple applications. And I think also what I call all comers, there's those of us who just want to be able to do our own personal growth, and who may have been talk therapy for a while and you're feeling a bit stuck there. I think that there's applications even for well folks.
Yeah. There's a question here about the television show 9 Perfect Strangers. I don't know if you guys have heard about it or seen it. It was recently out. I did see it. Nicole Kidman is a retreat leader in the show, and she has 9 people come to do a retreat, and they come for all different things, but there is a grieving family. They've lost one of their children, and their daughter is also with them. And it's a pretty intense show, and it's got some ups and downs and some dark spots, but I'm not sure it does great PR for this. And so someone was asking about that, but I'm not sure if you guys haven't seen it, maybe you know how to answer to it. But it's definitely spilling out into the culture. And I think people are very curious, but I guess maybe the question here is, how can we have more positive and helpful depictions of this? That one's not necessarily one.
From what I've heard about that show, and I don't even have a television, so I don't know anything about any of this kind of stuff that's in popular television. But what I've read about in reviews about that show is that I don't think, and I'm talking as a psychiatrist, right? I don't think it's good to have people journeying together with different issues when those issues are very, very powerful for them. I think it's better but again, this is early days, but I still think it's better to have grieving parents together, people who are grieving a spouse together, people who are, different, whatever the groups are, like the old PTSD rules about group work with PTSD. You don't have, rape victims in with war soldiers who have war trauma. Like, you separate them out, you have them in their specific groups. And I think that follows as well for work with psilocybin mushrooms. And so I think they needed all those different types of characters for that show, but I think that's misleading.
I agree. There was a lot misleading there. Let's move on from it. Here's another question. How would the panel members, all of you, break down processing trauma or grief? What are we really talking about here? Is it more than sitting with emotions?
Absolutely. I coming to it just from being in it right now. It's, I think for myself, and I can speak for all of us that were at this retreat together. I mean, it's like an onion, like Dingle said, you start with
lose my power in a minute, so excuse me.
You start with dealing with your initial loss. I mean, the loss of your child, but then once you delve into this, you realize if you haven't tended to your prior traumas and things inside of you, you're never going to deal with what's on the table. So I think for all of us, it's like we came to this because we lost our child, but we've come to terms with now we're going deeper and dealing with things that happened in our childhood and, whatever it is, whatever the traumas are inside of us, you can't deal with one without dealing with, I'd say, them all.
Mm-hmm. Yeah, I think that's a really important part to touch on, that I think grief asks us to look at our whole lives. Grief asks us to look at who we are and who we've been and what our relationships are with the people around us and the world around us. And so I can imagine that everything comes up when you do something like this. You go for grief and for loss, but you end up with a whole picture of everything. Someone asks here, is this just for complicated grief? Is it just for people who are having trouble accessing their grief? Or is it helpful for anyone who is grieving, maybe even someone who's already very present?
I'll jump in. I lost my mum on the 31st of October last year. She was 94. So, people were like, oh, she was old and whatever, but we were very, very, very close. And I was able to do my first mushroom journey ever 6 weeks after she died. And I've continued to have some journeys, guided ones. And I have to say that it's probably the most helpful thing that I'm doing and have done. And so I don't think you have to be like distraught, complicated, super stuck. I think grief is grief. And I really do think that the mushroom medicine can make a big, big difference in helping one process. And again, I'll just return back to that thing is, our society and even the way medicine is practiced, it teaches us to push things away, to suppress things. And, we kind of need to do the opposite, is to actually face it head on. And in so doing comes the healing.
Dingle, you made me think of something as well. It's to have a guide that knows the space just seems so important. I mean, I know on my journey, Dingle was with me and everybody else was able to complete their journey and leave the space and go on. And I wasn't. I needed to stay in that space. And Dingle stayed with me all night. And she did so because she knew where I was at. She knew that space and she knew what I needed. And I think that if you're not familiar with the psychedelic space to help somebody through it, I can't imagine doing that without knowing the space yourself.
Mm-hmm.
That touches on a great last question. Do you also need to be familiar with grief on a personal level, you think, to do this kind of work as a guide?
I think, one of the truisms that seems to exist in psychedelic therapy is that that unless the person who is under the influence in the journey, it's really hard for them to go beyond what their guide has done. And now that's not always true, but you want a guide with tons and tons of experience and life experience as well as medicine experience, wisdom, because that's what is required.
That makes sense. I am so grateful to all of you for sharing your experiences, your wisdom today, and just talking about this and bringing it out into the world more. I think that this is going to have a profound impact on how we understand grief and how we move through it in our culture. Thank you all so much.